Have you ever truly stopped to think, what would I do if a heart attack struck me right now and I was completely alone? It's a haunting scenario, one that becomes more likely as we age, especially for those living alone or spending much of their time by themselves. We all like to believe that if something goes wrong, someone will be there, a neighbor, a spouse, a quick-thinking friend. But in reality, the majority of fatal heart attacks happen at home, and often when the person is alone. Now, that may sound terrifying, but here's the empowering truth. Even if you're alone, even if you live by yourself, you can survive a heart attack if you know what to do and act quickly. In this video, we're going to guide you through 7 critical steps that could literally mean the difference between life and death. You won't need medical training. You won't need expensive gadgets. You just need awareness, preparation, and calm. Step 1. Recognize the silent early signs of a heart attack. The most important part of surviving a heart attack is knowing it's happening before it's too late. Forget what you've seen in movies, the dramatic clutching of the chest, the sudden collapse, the shouting and chaos. Real heart attacks, especially in older adults, often don't look like that at all. They can start quietly, silently, and in those first few moments, your body may only whisper a warning. What should you look for? A tightness or pressure in your chest, not necessarily pain, more like a squeezing or fullness. Shortness of breath, even if you're not moving. Discomfort that spreads to your neck, jaw, shoulders, arms, or even upper back. A cold sweat, dizziness, or feeling faint. Nausea, often mistaken for indigestion. Unusual fatigue, especially if it comes on suddenly and without explanation. Take Richard, 74, for example. He was sitting at the kitchen table when he noticed a strange tightness under his collarbone, like mild heartburn. Then came the shortness of breath, and his palms began to sweat. He didn't wait. He remembered reading that not all heart attacks start with pain. That quick decision to act instead of second-guessing saved his life. Remember, the body whispers before it screams. If something feels off, don't ignore it. Don't assume it's gas or anxiety. Your body could be trying to tell you it's in distress. Treat any unusual combination of symptoms as a red flag. You can always be wrong and alive. Step 2. Call emergency services immediately. Don't wait. The very next step is non-negotiable. Call 911. Do not wait. Do not try to walk it off. Do not get in your car and drive yourself. Do not call your adult child, your neighbor, or your friend first. Call emergency services. Every minute matters. When your heart isn't getting enough oxygen, damage begins. The longer you delay, the worse it gets. Calling 911 means trained professionals will be prepping life-saving tools while on the way to you. They're bringing oxygen, nitroglycerin, AEDs, a team trained to stabilize you before you even reach a hospital. What's more, heart attack symptoms can escalate fast. If you try to drive and pass out, the result could be fatal, not just for you, but for others too. Let me tell you about Linda, 78. She felt a strange ache in her left shoulder, followed by nausea and sweating. She almost picked up the phone to call her son, but instead, she remembered a nurse once telling her, "If you think it's your heart, call 911. Talk to your family later." She made the call. The paramedics arrived just as her symptoms worsened. She survived because she didn't hesitate. And don't worry about wasting anyone's time. Dispatchers would rather come and find nothing than miss the chance to save you. Pro tip: keep your phone accessible, by your bed, in the kitchen, even on a lanyard. Learn how to activate emergency SOS features. On many phones, you can press the side button 5 times or hold specific buttons to call 911 automatically. Step 3. Chew an aspirin, not swallow, chew. Once you've called for help, Your next step can be surprisingly simple. Chew a regular aspirin. Why chewing? Because it gets the medication into your bloodstream faster than swallowing whole. A 325 milligram non-coated aspirin can slow or stop the formation of blood clots, which are often the cause of heart attacks. It might even partially restore blood flow, buying you precious time. But let's be careful. Only chew it if you're not allergic and not on blood thinners, like warfarin. Don't use enteric-coated or delayed-release versions if you can avoid it. But if that's all you have, chew it anyway in an emergency. Let me introduce Joe, 72. He felt that telltale chest tightness creeping up into his jaw. He remembered an old bottle of aspirin in the kitchen. He chewed one tablet slowly, then sat down and waited for paramedics. Later, his cardiologist said that single act likely reduced heart muscle damage significantly. If you live alone, store aspirin in easy-to-reach places, your nightstand, kitchen drawer, even taped inside your medicine cabinet door. Check the expiration date every few months. That tiny white pill could be your lifeline. Step 4. Sit or lie down to reduce strain on your heart. Once you've called emergency services and chewed an aspirin, your next priority is to minimize the workload on your heart. This means finding a comfortable position and staying as still as possible. Why is this important? Physical activity increases your heart rate and blood pressure, which can exacerbate the damage during a heart attack. By sitting or lying down, you help your heart conserve energy and reduce the risk of complications. How to position yourself. Sit down with your back supported, feet flat on the floor, and arms resting comfortably. If you feel faint or dizzy, lie down on your side with your head slightly elevated. Avoid lying completely flat, as this can make breathing more difficult. Real-life example. Alice, 81, felt pressure across her chest while cleaning the kitchen. Her first instinct was to finish tidying up, but she remembered her doctor's advice. If you think it's your heart, sit down. She sat in her recliner and waited for help, which likely prevented her symptoms from escalating. Key takeaway: once symptoms begin, stop all activity immediately. Sit or lie down in a comfortable position and wait for emergency services to arrive. Step 5. Practice deep breathing to stay calm. Panic can worsen a heart attack by increasing your heart rate and blood pressure. Practicing deep breathing helps you stay calm and ensures your body gets the oxygen it needs. How to practice deep breathing. 1. Inhale slowly through your nose for a count of 4. 2. Hold your breath for a count of 2. 3. Exhale slowly through your mouth for a count of 6. 4. Repeat this cycle several times. Why this works? Deep breathing activates your parasympathetic nervous system, which helps slow your heart rate and reduce anxiety. This technique is simple yet effective in managing stress during a heart attack. Pro tip: focus your thoughts on your breathing. This mindfulness can distract you from pain and fear, helping you remain composed until help arrives. Step 6. Unlock your door and prepare for emergency responders. Time is critical during a heart attack. Ensuring that emergency responders can access your home without delay can make a significant difference. Steps to take: unlock your front door to allow paramedics to enter quickly. If possible, turn on a porch light or place a visible marker near your entrance to guide responders. Gather any medications or medical information that might be helpful to emergency personnel. Why this matters: emergency responders may lose valuable minutes if they have to force entry into your home. By unlocking the door and making your location easily identifiable, you expedite their ability to provide care. Real-life example: Medical News Today advises that if you're indoors during a heart attack, unlocking your front door and lying down near it can facilitate quicker access for emergency services.